Water birthing is gaining a lot of popularity in India, especially in Delhi NCR. Hi, I'm Dr. Deepika, Director Obstetrics and Gynecology at Birla Hospital, Gurgaon. I've been working as gynecologist for the last 25 years. Out of that, I worked in London for 15 years, and that's where my expertise of water birthing comes from. After having delivered many patients by successful water birthing here at Birla Hospital, Gurgaon, I thought, let me educate through this platform all of the women who are aspiring for this noble form of normal delivery. There are some frequently asked questions which every woman have more or less asked me in the last 6-7 years, ever since I have been practicing here. Let me take on that. So the most frequently asked question is, ma'am, what is the difference between water birthing and natural birthing? Well, as the name says, water birthing means delivery inside the pool, which means the baby comes, they deliver underneath the water and then they swim. That is the main difference. The second question that asked from me is, ma'am, is it safe to have a water birthing delivery? Yes, it is very safe to have this kind of delivery. The most important thing is that wherever you are seeking this delivery, there should be expertise in carrying out the procedure. There should be strict protocols and policies adhered and followed by the hospital, and there should be specialist nursing. That is the most important criteria. So you should only choose a hospital and an expert where you see the expertise, or at least where they can demonstrate the expertise. What are the indications, by which I mean which woman can actually opt for water birthing? There are different criteria which your expert or your gynecologist would help you in deciding. The first and the foremost criteria is that you should come in spontaneous labor. If for any reason we are having to do induction of labor, by which I mean artificially inducing the labor pains, then you cannot have water birthing. Water birthing is a very natural form. We do not use any medications in that. We do not even put IV line in your hands. We just allow the labor to happen naturally. And when you are in active phase of labor, which means 3 to 4 centimeter dilated, we would then allow you to enter into the birthing pool. The other reasons why you will not be given a permission for water birthing would be if you develop any medical complications in pregnancy, like diabetes or hypertension, or for any reason if the babies are going small or the fluid around the baby is less, then we would suggest to go for artificial induction of labor, and we can't do water birthing. If you have had previous cesarean section, unfortunately you cannot have water birthing because we would need to monitor you throughout your labor process. The weight is also an important criteria. If your weight is more than 100 kg, then it is a relative contraindication. And at the end, water birthing is a choice of a mother. It is a discussion that happens between your expert and yourself, and it is entirely up to you whether you want to go ahead with a water birthing or a normal birthing like we do traditionally on the bed. How safe is it for my baby? Because baby is of course coming inside the water. Well, again, it is very safe. Babies have a reflex called as diving reflex, which means when they are delivering underneath the water, they will not inhale, they will not take any breath inside, they will not aspirate the water. And also remember, baby is always in the pool of water inside her mother's tummy, which we call as liquid. So baby is coming from one pool of water to another pool of water, and then by nature, with diving reflex, he or she is not going to breathe inside. What is though important is that the expert who is delivering you, we should not be touching the baby. We should not be forcing the baby and trying to take the baby out underneath the water. We should just allow the baby to swim naturally on the surface of water. What are the reasons when we would want to abandon water birthing? By which I mean that now you are into the pool, however, your expert will ask you that we can no longer proceed for that. Mainly there are 3 reasons. First is, in any case if you develop fever, fever is a sign of infection, then we don't want to do it. If the baby passes meconium underneath water, then of course you can't have it. And last but not the least is the mother's choice. Again, occasionally I see if any mother feels that she needs more pain relief in terms of, for example, epidural, which is a painless labor, then she cannot have a water birthing, but she would then be asked to come out of the pool. We can then give her epidural and we can go ahead with the natural delivery. So these are the reasons why we won't do it. Last but not the least, again the question comes is there any difference in the post-delivery care? Well, not really. Whether you deliver inside the pool or you deliver outside, the treatment for your postnatal care is no different. Generally speaking, in water birthing, we do not give any cut or episiotomy at the time of delivery because the warm water that we are using, which is maintained at 37.8 degrees throughout the process, it helps in softening the perineum and the baby will come with some tear on the vagina, which I would stitch it on the bed and a woman can go home the very next day. The perineal hygiene remains the same by giving the SIDS bath, if need be antibiotic ointment, and then just taking care that no infections happen by putting some ointment morning and evening for 7 days. So again, water birthing is a very novel technique here in India. To my understanding, CK Birla Hospital, Gurgaon is the only hospital in Delhi NCR who is delivering this facility and we carry great expertise. Thank you.